I'm Susan Piecynski. I'm one of the trauma nurse practitioners with Trauma Services at Genessis Healthcare System in Ohio. Genessis Healthcare System has been a verified trauma center since 2011, and as part of being a verified trauma center, we do injury prevention outreach to the community. And in order to guide those programs, those injury prevention programs, we collect data from a 6-county region in southeastern Ohio, track the injuries that come into the hospital, and track the primary mechanisms that cause these injuries. So far, the mechanisms that are most prevalent in this area that we work on, that we've guided our focus towards, is motor vehicle crashes, ATV crashes, and falls. One of our primary injury prevention programs specifically deals with falls, because there are a lot of elderly folks that fall. In addition, we have a lot of falls off ladders, scaffolding, with all the construction businesses in the area. So as part of the community outreach, speakers go out to the local organizations, senior centers, businesses, and large employers that have high fall risks for their employees, and just discuss the different ways that they can prevent their employees from falling or prevent their residents, elderly folks, family members from falling. Another one of our largest injury mechanisms groups is motor vehicle crashes, and as a result of this, we try to head off as many car accidents as are preventable through a program primarily that goes out to the high schools and middle schools to target texting and driving and distracted driving, as those are big problems that oftentimes lead to motor vehicle crashes. So that is addressed through a couple of different mechanisms, through the schools, through health fairs. There are also T-shirts that are available that advertise, don't text and drive, and to reduce distracted driving, seatbelt use, and following the speed limits, and small things that can actually prevent motor vehicle crashes. I know one thing that has actually impacted our prevention was the don't text and drive bill that was passed. That has also been a big success for our trauma program. So the majority of these distracted driving and prevention of motor vehicle crashes programs are actually through our Think First program that targets the preschool through high school age, and it does not only focus on motor vehicle crashes, but it also focuses on other injury prevention, such as helmet safety. There's a big push to teach the children bicycle riding, ATV usage, to wear helmets to prevent the head injuries that we so often see that range from concussions to severe bleeds that can be debilitating and life-changing. More on our head injury prevention, we actually have a shaken baby simulator to teach the community that shaken baby syndrome is actually a head injury that is produced from shaking a child too forcefully. And so that is another component of the head injury outreach. We also have in the community impact testing, which is geared towards athletes, high school and middle school, to prevent concussions. So children are tested at their baseline level before they would even have a concussion, and retested after they've had a concussion to make sure that they're back at their baseline before they're released to play, to make sure that they're safe from that head injury before resuming their normal daily activities. So if you would like more information about our injury prevention program with the Trauma Services at Genessis, or if you are interested in having a speaker come out and do some of this injury prevention program with any groups that you have, please visit the Genessis Healthcare System website for more information.